Dr. Malte, thanks for joining us today, and welcome to the area. You're relatively new to the Mountain Home Twin Lakes area.
Yes, I am.
Yeah.
Yep.
And you're at the Baxter Regional Nephrology and Pulmonology Clinic with
That's correct.
Dr. Martin and Matthews.
Yes.
Okay, well, welcome. Is that going well for you?
It's going great.
Great.
Yeah, thanks.
Good, good. Can you tell some of our viewers today, with pulmonology, of course that's all about the lungs, what are some things that they can be looking for? I know they always kind of jump in here just based on some data that I looked at yesterday. People always associate lung problems with smoking, but that's not always the case. Is that correct?
That's correct. Smoking obviously is the #1 leading cause of lung cancer. Smoking in itself will not automatically lead to lung cancer. As you very well know, not every smoker develops lung cancer. So majority of their complaints would be shortness of breath. And shortness of breath could be a diagnosis that would lead to COPD.
Which is coronary help me here.
Yeah, it's chronic obstructive pulmonary disease.
Chronic obstructive pulmonary disease. You had to think for a second today. My whole
correct.
day has gone like this, so it's okay.
That's good enough.
Okay, COPD.
Yes.
Yes.
So COPD is a chronic disease. It's irreversible, but it could be managed. So you can use inhalers, and if diagnosed appropriately and at the right time, you can actually qualify for possible surgery if you're the right candidate.
Oh, really? And then what will that do as far as surgery goes?
So if you're the appropriate candidate, if you do surgery, it's actually been proven to prolong life, meaning your life will be extended, and it would also improve your symptoms.
So a little better quality of life.
That's right.
Right, right. On this, now COPD, is this something that people just genetically are predisposed to? Is it, are they maybe have had pleurisy, pneumonia, and this is the result of it, or am I way off base?
Actually, it can develop in patients who have had normal lungs. However, if you chronically smoke, smoking in itself damages the lung tissue.
Yes.
And you can actually, anyone could be predisposed to developing COPD. Now, there's a very rare variant of COPD, which is genetic.
Okay, but there is a little genetic component there.
That's correct.
Yeah. Okay.
Yes.
So, but well, I guess what I'm asking is, does pleurisy, if you've had pleurisy as a child, pneumonia as a child, are you predisposed for a lung condition down the road, or? It
can eventually, because as you have infections in your lungs at a young age, it could damage your lung tissue enough that, you know, any other insult to the lung can hasten the damaging process.
Okay, kind of becomes your Achilles heel to your body?
Exactly.
Yeah, okay. All right. What else now, on the patients that you are seeing, what are you seeing here in our area, in the Twin Lakes area, a lot of?
It's not really a lot of, but I think one of the things that I'm looking into is pulmonary hypertension. It's a diagnosis that not many physicians look into, but it's actually real and it's there. We've had patients from this area who we actually managed back in St. Louis when I was training there.
Really?
That's correct, yes. And it's interesting because if you diagnose it early, you can actually manage it. And it presents usually as shortness of breath. So people even in their early 30s could have shortness of breath.
Really?
And not know that they have pulmonary hypertension.
Yeah. How would you distinguish between, I'm thinking if I climb a flight of stairs, I'm so out of shape right now, there's a little shortness of breath, but is that my lungs or is that just being out of shape? So
yeah. So there are different tests to determine whether you're out of shape or if it's the lung that's causing your symptoms. Obviously, your primary care physician will probably be the first one to screen you for pulmonary hypertension. And the way it's done is if you have shortness of breath, and you have other predisposing factors, for instance, lupus, or liver problems from hepatitis or chronic liver disease, you can be predisposed to developing pulmonary hypertension. And so those are the things we look for. And once they refer to us, we do further testing to determine whether it's the rare variant form of pulmonary disease.
My goodness, my goodness. Lupus, that is actually, can you explain that a little bit more?
So lupus is a connective tissue disease. It's a multisystemic disease. It could affect your lungs, heart, liver, kidneys, and blood. People would
it just basically kind of goes where it wants.
Correct. Yeah. So people will present with sometimes facial rash or joint pains, and eventually develop lung problems such as shortness of breath, or even fluid around their lung, which we call pleural effusion. And sometimes they'll have also renal failure.
Oh my goodness! Wow. I know that I'm thinking of a particular friend from years and years ago. Lupus was misdiagnosed as the flu.
It could.
Yeah.
Yes.
They were giving her antibiotic all the time, and take your antibiotics, and that'll take care of everything. And but in fact, it was lupus that she had. So yeah, and hers hit her heart. So she's had a real struggle getting back on her feet. But once they determined what it was, they were able to treat it correctly.
Right.
So
yeah.
Sounds like that's a big factor in all of this, making sure that you diagnose correctly, of course, and then to have the most accurate taking care of it down the road. So yeah, but and what else are you seeing then here?
So a lot of interstitial lung diseases. It's a disease where the actual lung tissue is being affected, and that could come from a whole lot of things. Majority of them would be occupational diseases. So if you've been exposed to asbestos, for instance.
Oh my! Well, I'm thinking with all the boat building that they do, with all the chemicals that they're using and the fiberglass and that kind of thing. It's not asbestos, but it's certainly got to be occupational. Yeah. Maybe not very good for you.
Yeah. So especially for those occupations where you don't wear masks, where it's supposed to be indicated, you can be predisposed to having these lung diseases. Yeah. Wow. I bet you probably do see a lot just for that. How about environmentally? Is there anything here that can... Environmentally, we're looking more at infectious diseases. So you would have maybe Ehrlichia, those tick-borne diseases. Right. Those are the things that you'll probably see here. I have not yet seen one, although obviously I'm just new in the area. Yeah. How long have you been here now? So about a month and a half. Oh my goodness. Yes. It just seems like you've been here forever because you're so warm and welcoming. Everybody loves to be around you, and your patients, I bet, already just love you. So well, I love my patients too. They're very nice. It comes right back. Exactly. Now, did you move here with a family? That's correct. I did. Okay. You have your wife and... Yeah, wife, 3 children, and 1 on the way. Oh my goodness! Congratulations. Thank you. When's the new baby going to be born? In November 18th is the due date. Okay. Yes. All right. A Thanksgiving baby, something to be really thankful for. Yeah. Exactly. So you have 3 children already, boys, girls? All girls. All girls. Yes. Do you know what the sex is of the 4th one? Another girl. You can start your own volleyball team. It's good. Yeah, it's real big good. Here. Yep, I'll be the coach. Okay. Oh dear. Well, are they all adapting? Are they school age? Yeah. One is a school age. Yeah. Yes. So well, we've got great schools here. Just absolutely wonderful. I'm very pleased by it. Oh, good. Good. Well, I know that I want to ask a little bit more about with your practice. Can you explain what an ENB is? So ENB is electromagnetic navigational bronchoscopy. It's used to diagnose spots in your lungs that are far out in the lung tissue that you could not see. Okay. What we do is we put an device into your lung through a scope, and we actually correlate it with a CAT scan of your chest, so we know exactly where we're going. Right. And we take pieces of that lesion or tissue, and using that navigational bronchoscopy or that type of bronchoscopy, our yield of getting a diagnosis is way better than it was from years past. Right. And is this something you can do right at the clinic? Is this done in the hospital? It's something that we do in the hospital. Okay. People will usually be under anesthesia for this procedure. I was kind of hoping that was the answer. And was going, I think if you're going into my lungs, I don't want to. I don't want to wake up. No, yeah. So you'll pretty much be asleep for the entire procedure. And the diagnosis, usually we have a pathologist on standby just to help us know where if we're exactly getting the right amount of tissue that we need.
Right. And then what's the next step from there? That's done on an outpatient basis, though, isn't it?
That is an outpatient
Yeah.
basis,
Okay.
yes.
All right.
So next step would be we follow up with the patients in the clinic in a week's time.
Okay.
We would have the results hopefully by then, which is usually the case, and then we take it from there, depending on the diagnosis that we see.
Okay. Okay. So if something is found, once it's biopsied, if it's malignant or
Yes.
non-malignant, that'll make your decision for your next steps.
Correct.
Yes. Okay. All right. Doctor, we need to take just a short break.
Okay, sounds good.
Don't go away. We'll be right back with you.